13.3% of Uganda's population carry the sickle cell trait, meaning over 7 million Ugandans have the gene. Today, in our edition of the Youth On Madit, we are hosting Shirat Nantongo, a lady who has lived with sickle cell her entire life. But what is so interesting about today's edition is the story of Shirat Nantongo, a lady who is more than a warrior in the fight against sickle cell. It's a pleasure having you on Madit Updates.
Yes, so thank you for hosting me, Madit Updates. My name is Nantongo Shirat, a sickle cell warrior, a sickle cell victim, a person living with sickle cell disease. I'm 21 years old and an enrolled nurse by profession, currently volunteering at Komamboga Health Center 3.
Yes, Shirat, you've lived with sickle cell, throughout your life. When did you first realize that you are carrying a sickle cell, gene, and what is your experience with sickle cell?
Yes, so it has been quite a journey. I have not been newly diagnosed. I was diagnosed way back when I was still 1.5 years old. So I have lived with it since then. But since by that time I was not so much reasoning, I cannot remember what happened during that time. But my parent introduced me to the condition, so I grew up knowing the basics of my life status, my health status, and how to handle myself, how to manage myself. So I really don't know when I got to understand, but I grew up knowing how to take care of myself and knowing my condition perfectly well.
Shirat, let's talk about some of the challenges that you faced and you are still facing because of being a sickle cell patient.
The challenges have been along the way, in school, in society, at workplaces, and throughout the life you have to get challenges everywhere, just like any other normal person. So this case we are talking about how sickle cell can inconvenience you in your daily living. So this has been my story. I'm sharing my journey, and not to feel proud about anything or brag about anything, just trying to make people aware of the condition that is out there, but then giving them a reason to be hopeful so that they can live perfectly well like any normal being. So it has been quite a journey from my primary, secondary to campus. So the journey has not been very easy, especially in schools. Sickle cell people have triggers, and one of the triggers is stress. There are other triggers like some people, talking about ladies who suffer from sickle cell disease. Sometimes when they go in their periods, monthly periods, they experience a lot of pain, from the normal cramping to that intense pain, and some get admitted, and some people get joint pains and everything. But in my case, my number one trigger is stress. I never want to be stressed. So during my entire education course, it has been very tough for me in seasons of exams. That is when I get really sick. But then my teachers have been knowing about that, so it has not been a crime for me to move with a sweater everywhere I go, in exams, during classes. Sometimes it's shining and for me I'm feeling cold, so it is allowed for me to wear a sweater. They are excusing me for that. So that was primary bullying, So I had friends. I have been having friends. God has blessed me with friends that have been helping me fight my battles, because me, I'm not strong enough to fight them. Those physical battles, and they have been playing a good role during my entire education process. But then my schools, I very much give credit to my schools that I've been to. They have been able to understand me, accept my condition, and accept me as a student. I have been competing with very competitive students, and you have to perform according to the standards, of course. Yeah, you can't excuse yourself that I have been sick and that is why I failed in class. No, so you have to compete with your fellow students academically. So secondary, it was a journey too. Moderately. You know, secondary also comes with its lifestyle and all that, but God has carried me through it. I did not face a lot of problems during that period. It's just the normal stress that brings that problem to me. I get a lot of problems during examinations because of stress. And campus life, it has also been a journey, but I went through it.
Shirat, one may wonder, amidst all these challenges, how have you been able to, stay on top of it? I mean, being resilient and determined, to overcome whichever challenge comes your way. How have you been doing it?
Yes, so I thank God. First of all, the things that give me hope and keep me running is God. I want to thank Him so much for carrying me here, bringing me all the way to this far. He has carried me this journey. And some things that give me hope are my family. I want to make a difference. Whenever I move out there, I feel like I am one of the things that should give people hope. When people see you and they know about your history or something, they're like, I want to be like her. I want to be like her. So whenever a person says I want to be like her, I have to be that person they want to be like. So it keeps me moving. Not that I also want to be like successful in life or something, but I very much consider the people that I'm carrying, like people that are looking up to me. People are somewhere and they are saying, sickle cell people, we die early, we can't make it in life, we can't study so hard, we can't do this. And then I'm here to prove to those people that we can study, we can be lawyers, we can be everything we choose to be. We can be nurses, we can be surgeons, we can be doctors, and all that we want to be. So it gives me hope, it keeps me running, it keeps me moving, that someone may be there looking up to me, and then I'm not doing the needful. Because when someone looks up to you, you have to do the needful, so that they really mean what they say, that they want to be like you. So I have to be there. I have to be there. One of the things that make me take care of myself is that a lot of people are looking up to me, and I have to be that person they can be able to look up to without, disappointing them. And the usual basics. One of them, right here.
What's that?
Yes, so today carrot tea.
Tea?
Yes, so it's a hot day, as you guys see, but I don't want to take water, so this is tea. Yes, so one of the things that keep me moving, taking care of myself. I have to take tea. I have to carry a sweater everywhere I go. I have to create a comfortable environment for me. Taking drugs regularly, because we take drugs. Every sickle cell person is supposed to be taking a drug, at least one. You should be taking a drug every day to ease your journey as a sickler person. So I personally, I take hydroxyurea, 2 capsules a day, it's not the normal dose for everyone. Everyone has their own doses according to what their clinician says. So my dose is 2 capsules every day, and then there is folic acid, monthly fancida, plenty of fluids. Like I said, you guys, today I carry tea because it's a hot day, but then I don't want water. But then, as it's prescribed, you should take 3 liters, at least 3 and more. So I can't go below 3 liters. So if I don't want to take water, I find other ways to get that water into my body. That is how I take juice, I take tea, I take water, I take ORS, something that can make it up to 3 liters a day.
Yes, Shirat, we understand that you pursued, a career in medicine, and now you are a practicing nurse. What really inspired you, to journey into medicine? Or did your condition push you for that?
Yes, so thank you for that question. I usually like that question so much because it always comes with a story to tell. So here's my story, a brief one. I'm going to make it a little quick. So growing up, I never wanted to be a nurse or something, anything related to medicine. So it wasn't in my mind by that time. So growing up and the condition our country, our beloved country, Uganda, was in at the moment, Yeah, so my society and the country, the condition of the country we're living in, inspired me to get to a point of...
Just to step in a little bit, when you say the condition of your country, what do you mean?
Yes, so the condition I mean is like, a lot of unresolved cases, a lot of safety, a lot of political insecurities, especially during politics. So this one is kidnapped, this one is what, no reasons, no transparency, we don't know what is happening. So I was that person that I want to be knowing whatever is happening. I want to be up to date. I want to know what is happening. Why is it happening? So that was me. And I was like, I think we are living unfairly here. I need to make a difference. So that is when the idea of becoming a detective popped in.
A detective, you say?
Yes. Yes, I said it and I said it right. I wanted to be a detective. So on wanting to be a detective, upgrading in my academics, we reached a point when we needed to take subjects that are directly moving to that path of that career. So that is when we went in for career guidance, and the results were not good. I should say the results were like, I can't be a detective due to my health condition.
Okay.
And that is why we are here. We are mainly talking about how to live with sickle cell. So I couldn't be a detective with sickle cell disease because there are some trainings that detectives go through and they can't go through them. They have to hold guns. I don't know whether it's called gun training. Anyone watching who knows that part can elaborate more about it. But I couldn't go for gun training, and that is how I was eliminated out of it. So the only options which I had were in medicine or some other stuff. But then, yeah, here I am in medicine. So I came into medicine. Another brief story. I was sitting for my national exams some time back, and I was in a crisis. So I needed blood. I needed a blood transfusion. I went to some government facility. I won't mention their name because we needed blood, and it could be easily accessed there. So the doctors that worked on me just, I don't know if they weren't fair enough or something, but they know I needed blood because they recommended themselves that I should be getting blood. But then by that time I wasn't helped. So
sorry about that.
yeah, I wasn't helped, and it was like I was admitted on Friday and then I had Monday exams on Monday. So it was a tough situation. It made me really pissed with the medical setting. And then I was like, I can make a difference for people like me, because we're in pain, we are crying. You know, you can meet someone very old with sickle cell disease, but when they're in crisis, you cannot even tell their age because they are crawling, just crawling because of pain. So what happened to me stimulated me, because my family had backed me up in taking a medical course, but then I wasn't feeling that inside me. But that stimulated me. It was like, you should go for that. You can manage. But then you need to make a difference. You need to make a difference of how you guys are treated in hospitals. So that is how I got into the medical field, when I'm passionate about it, because I needed to make a difference. Now I can do that because I'm there. And when I get a person who is like me, I don't expose you, but when I tell you something and you don't understand, because people cannot understand me, you may think I'm very normal. So I put you aside and I'm like, we can do this together. We can make life together because I'm like you. And they're like, no, you can't be like that. I'm like you. When I have a crisis too, I act more than you do, because this is not, oh my God. And then you just have to explain to them. But as I'm here, an inner nurse, anyone with sickle cell disease can be like me.
Yes, Shirat, there are many people who are living with sickle cell disease and other chronic illnesses. How would you want society to understand them, to treat them and support them?
Yes, so community should not feel like people living with sickle cell disease are cursed. It is not a punishment from God. No one in their family did something wrong to God or wronged God in any way. But it's part of life. It's just part of life. And it's very normal. And to someone who has not been with a person with sickle cell yet, please don't be too much, don't offend them, because you never know what is coming in your way. Because according to the normal population now in Uganda, more people have been diagnosed with sickle cell disease, and those who have not been diagnosed, they are carriers. So the number is growing, and you should treat these people leniently. Just like, people living with different diseases, people living with cancer, people living with HIV. And one thing I like about sickle cell disease, I don't know if I should like it, but I feel happy about it. Sickle cell disease is not a disease that you're going to transmit. If I have it and then you don't, it is no problem. Like, we can live without you even being, I'm going to get it anytime, I'm going to get it. No. It's not even transmitted through anything, sharps or all that stuff. It is genetical. It is genes. So carrier, you can have one. But then a carrier with a normal person, you just create another carrier. But then sickle cell, that is when you get a baby who is a sickler too. So it moves like that. It's a sequence. So community should understand that. The way I understand it, I think it has no problem. It's not an offense. We should treat these people leniently, and we should understand. We should not judge. We should be lenient about it. When you see a person crying, please kindly help them, because it's too much pain. It's too much pain. When this person is lively, they are very lively. Sickle cell people are very lively. But then when the crisis that when they get a crisis, oh, it's another story. You may think they are now babies, but they are not. It's just the pain. So I could ask the community to treat us. I'm saying us because I'm part of the patients. You should take care of. You should treat us kindly, gently, passionately. In hospitals, please understand. That is where I give credit to the Sickle Cell Clinic Mulago. Those people have specialized. They are specialized and they know how to treat us a different way. They handle us the way they should. They know this pain can be managed by this, but then the pain, this one is more, this one. And that is how they manage us. They don't discriminate us, and I thank them.
Shirat, let's say today you get opportunity to meet the President of the Republic of Uganda, Yoweri Kaguta Museveni. What special message regarding the health care, welfare and support for people living with sickle cell would you share with him?
Yes, so to the President of Uganda, General His Excellency Yoweri Kaguta Museveni, I could like to thank you. Thank you for the work done. And to the government of Uganda, we thank you for the facilities you've set aside for us. We thank you for creating awareness to the people, because now it's very easy for a person to know about sickle cell due to the different platforms they have put out there to talk about the case that we are on. And to the government of Uganda, I would like to ask for more support in terms of medicine, the painkillers, more, I don't want to say more, but more painkillers, but you know, and the drugs, especially hydroxyurea to the sickle cell patients, because hydroxyurea is very much expensive and it's the one that keeps us going. It is a drug that works on us very well. So sometimes it's insufficient in our facilities, and I could like to ask for more facilities that in every region, so that it is accessible for every Ugandan for care, and and more specialists in those facilities, because not every doctor can understand that, or not every nurse can understand that. Like I said, the pain is different, so some health workers just don't understand that pain. They think all pain is general, but we could like to have more specialists in those facilities and more drugs. So that is all about it.
Shirat, finally, as you reflect on your journey, how would you want your parents, friends, and everyone who stood by you throughout, your challenges that you've been facing being a sickle cell person, remember Shirat Nantongo?
I would like to first of all thank my mother, Miss Nambiru Veronica. She has been there throughout the whole journey. There is a time I thought she could be also a medical worker, because I was like, you're doing a lot of stuff for me. Like, she could do a lot of stuff. You mean
she cares so much for you?
Yeah. Of course, she knows. Okay, there was a time when I thought she knew it all. She knows every drug to work on me. She knows the dosages. She knows the time. She knows everything. She can even recommend it. Like, you can be.
So, she's not a medical personnel?
Yes, she's not.
Ladies and gentlemen, the mother of Shirat is not a medical personnel, but she knows everything when it comes to medication, prescription. Surprise!
Yes. So my mom is not a medical personnel, but everything about sickle cell disease, she can relate. She can relate because she has taught me the things, even before becoming a medical personnel, me. She has taught me the things because she taught me, the first thing she taught me was to take care of myself. Taking care of myself involved drugs and food, lifestyle, everything. So that is how I thought she could be a medic or something like that. But she wasn't, and she's not. Yeah. But I thank her for truly investing in learning about the condition, accepting it and learning how to live with it in harmony. Yes, so I have been able to live. She taught me a lot of things, how to take care of myself. Even before going to the doctors to teach me how to take care of myself, they first taught her, and she taught me. Yes, so I'd like to thank my mom, Miss Nambiru Veronica. I would like to thank my sisters. They have been a support system to me because they did not neglect me or something. I'm the only child with sickle cell disease in my family, and we have 5 children, so that is surprising. And out of those 5 children, you cannot say, I'm not the last born, so I'm there in the middle, but surprisingly I have, and they all don't have. Even the last one does not have.
So do they always support you? Are they willing to always come to you?
They always
you
do.
Support?
They always do. And when I'm admitted, they work in shifts. This one comes in the morning, afternoon, and night. So it's a whole journey for them.
I think that explains why you always carry smiles on your face, because you have people who are willing to support you.
Of course, it's a support system. When I say it's a support system, you guys can just relate to that. You can understand. It has been a journey, and we have moved the journey together. My family has been so supportive. My mom and my siblings. They have not isolated me in any way. They think I can do everything they can do, and they think I can do it better. Because sometimes when you're seated home, they're like, I think Shirat is going to do that because we are not able to do it. So she's going to do it for us. And I'm like, you guys know. And they're like, yes, you can. Yes, you can. So I think it has been a push factor to where I am. I've been supporting financially, physically, emotionally, and yeah, they have been there. I thank them so much. Then I thank my friends, especially the friends school has given me. You guys have been awesome. You've been there for me. My friends in school, Mirembe Patience.
So now, where is she watching you from?
Oh, Mirembe, hi, she's watching from Victoria University.
Oh, Victoria University.
Yeah,
wow.
She's in Victoria University. Then there is Nachaine Grace. That one is doing medicine also. She's getting a course in medicine too. Then there is Andrew Vesije and Nangovi Hope. They're also medics.
Surprisingly, all the names that you're mentioning are medics. Don't you have friends like from journalism department, electronics, like talk about hotel management?
Yeah. So when I was there, I first said I thank God for the friend school has given me. So the one at Victoria University, she came in early, very early. That was in my early years in primary school.
Okay.
So she carried me. She carried me throughout those years. And when we separated in secondary schools, she asked the parents to shift her to my school because I was like, girl, I'm here, I'm bored, I don't have friends. I can come in. So it was one of the reasons she left her school to come to my school. Yeah, I thank her so much. She was really there. She's a good friend. And then my friends in nursing school, some did lab, and some did nursing, then midwifery. So That is why when I say school friends, I have been spending a lot of time in boarding section and at campus, hostel life. So school has given me those friends. I rarely make friends out here because, we get short holidays. So you have no time to, get in touch with more people. But then the friend school has given me, and then my social friends. I thank you guys so much, so very much. No one has judged me. And those friends, they are the very friends that have fought for me in school. You cannot stand and, accuse me of something or what, and then they don't come in. They have been there. So I thank God for my friends. I thank God for everyone that has been through this journey with me. Everyone. I cannot break all of you guys, but you're all my friends, and I love you so much.
Shirat Nantongo lived with sickle cell her entire life, and as you can see, she's carrying smiles all over her faces. I don't know what problem you could be going through. Ladies and gentlemen, remember, you can leave it. We've been with Shirat Nantongo on the Youth On Madit. Do follow us on TikTok, subscribe to our YouTube channel, and for more information, do reach out to us on 0784017400. Thank you for always supporting Madit Updates. Until we meet again. Bye-bye.